What we're here today to talk about aging and being a senior and some of the things that are going on. And you are only as strong, a country is only as strong as its weakest links. And sometimes its weakest links are the poor. Well, guess what? Now what's happening is the weakest link is also the aged. In many instances, where we thought we had a system that was built in. A lot of people felt that early on that they did what they needed to do by getting jobs. They had retirement. They put in Social Security, and they thought when they retired that it's going to take care of them. And then you get there and you realize, oh, this is enough money to do this. But it's more than that. It's also about maintaining a quality of life in our senior years. Which is the most important. I caregave for both my parents. My mother died in 2000 and my father died in 2007. But I did a lot of caregiving. And we were people who normally did not, we put in the system. We were very active in the community and we were always the givers. But when you had to all of a sudden be on the receiving end, it was humbling. It was humbling. And it was humbling to be on the receiving end when you were elderly in your age and you're used to just being the one out there just giving. And now all of a sudden you need somebody to come and just help you get out of bed. You know, so you're dealing with an emotional point in people's minds, in people's lives, where at the same time, you know, my body's telling me I'm 63, but my mind still is 25, and I want to go out there and do some of the things that I used to do, and I just can't do it anymore. So we're all grappling with that kind of thing, and we're looking at ways to take care of ourselves in our senior years. Well, having been a caregiver, what I learned is caregivers are more valuable sometimes than the person you're taking care of, and more fragile than the person you're taking care of. You know how many caregivers I know that gave out? They didn't make it because they were giving such a quality of care of people. But then I also can tell you the wonderful caregivers that entered into our lives. These people were loving, they were nurturing, they were caring, and it takes a special kind of person to be a caregiver. Now, one of the things that I think we need more of is we need to do some legislation that will allow more families to caregive. Because when caregiving stays in the family, then you're boosting up a whole family unit as well. Now, another problem with the caregivers today is they aren't paid enough. We know that. I think in 2000, when 98, when I first had my first with a caregiver, and I asked her how much money she made, and she told me she made $10 an hour. You know, those days back in 2000, that was considered a good job. Now, caregivers on an average don't make $10 an hour. This is years later. They can do much less on the money. It has not been a career that is being respected because they still see it as what women do. And I'm putting it on the woman's thing because 9 times out of 10 the women are the caregivers. So what my job is my job at the General Assembly is to try to identify some legislation that may enhance caregiving, that may be on your side, like increasing minimum wage and doing things that will help. That's my job, is for you to come to me and tell me what your needs are, and let's see if we can work out some kind of legislation and get it through the General Assembly that will enable caregivers to be able to do this. Another thing is, this is really considered a new career path. For those of you, the last 10 or 20 years, you know, caregiving has become, because the population is living longer. So we need to look at caregiving in a lot of levels, not just family caregiving, not just one-on-one caregiving, but community caregiving as well. So we have to look at all the pieces to make sure they fall in place. Now, those of you who are most familiar know that I do a lot in terms of food inequities and hungry. I am your corner store initiative. We found that kids and seniors in particular have trouble with being food insecure. And food insecure means you don't have it 3 times a day, 7 days a week. You know, when the storm came and school was out for a couple of weeks this past winter, I was absolutely worried because parents don't budget 2 weeks worth of breakfast, lunch, and dinner into their budgets. If you realize the storm came in the middle of the week, middle of the month, not when you first get your month and you have plenty of food, but in the middle and the end when resources were getting more limited. Then you found seniors who were unable to go out and get the stores, and you found a lot of young people, and I was very concerned. I understand the community stepped up a lot with bringing food and trying to take as much as they could to people who are in need. But again, my job at the General Assembly is to identify from you areas that we need help in and trying to come up with some creative legislation that enhances the quality of life. Because you can live longer and not have any kind of quality of life. So it's important not just we care for you, but we care for you well. And we care for you in a way that allows you to lead your life as full as you can. I don't want to take too much time because I know we got to discuss some real issues and numbers and statistics. But again, I'm Yvonne Holly, and thank you.
My name is Alan Fryer. I'm with the Justice Center, and I had the unenviable task of trying to speak after President Obama and Representative Holly, and to talk about numbers while you're eating lunch. So bear with me. We really want to be able to draw a connection between the quality of care that seniors receive and the quality of wages that paid caregivers receive. We want to, first I want to highlight the President's comments that we need to worry about finding more caregivers to make sure they're adequately supported to meet the needs of seniors. And I think Representative Holly spoke movingly about about unpaid caregivers. We're going to talk specifically about the challenges facing paid caregivers as they try to care for the seniors that they care about.
I jumped the gun.
There we go. So we all know North Carolina is rapidly aging. There are 1 million North Carolinians over the age of 65 today. By 2050, that number is going to double, and the number of folks over the age of 85 will make up about a quarter of the state's population by 2050. That means that demand is only going to grow for the types of caregiving that provides dignity and quality of life for our seniors. We have up here a chart with the three different types of caregivers. You have highly trained nurses, you have home health care aides and personal care aides. The categories are less important for this, but what is important is the fact that they are growing, these occupations are growing much, much faster than the overall economy. So we're going to see a boom in the number of seniors who need care and a boom in the number of caregivers who are there to meet those needs. Unfortunately, these are the fastest growing jobs in the economy, but unfortunately they pay the lowest wages. As you can see from the chart, the wages that go to our caregivers are $10 an hour about, and that's $5 less than what the average economy is paying the average worker. That means that half of all home health care workers aren't earning enough to earn above the poverty line, even when they're working more than full-time. And we should care about this because we recognize that the quality of wages directly influences the quality and the stability of care that seniors receive. Lower wages usually means higher turnover. Higher turnover happens because if a worker can't make enough to make ends meet by working one job, they're going to pick up a second job or a third job. And that means, as they try to balance these multiple jobs, they have to figure out how to pick up hours with one job, another set of hours with another. Over time, the schedule of caregiving will break down. So seniors, as you all know, will experience weaker stability in terms of the care that really matters. And so you know the consequences. More workers, different workers, working hard to try to get up to speed in a very, very challenging environment while trying to balance their own lives and their own incomes. So what's going on here? Why are North Carolina's caregivers paid so low in comparison to the rest of the economy? Part of this is just the economy is producing more and more low-wage jobs. 80% of the jobs that have been created since the end of the recession don't pay enough to make ends meet. Don't make enough to pay groceries, put your gas in your car, pay your rent. But a part of the answer is also directly attributable to the public policy decisions that have been made in the state. Part of this answer involves Medicaid, right? Medicaid is the primary funding source for long-term services and supports for people with disabilities and seniors. Reimbursement by Medicaid programs in large part creates the framework by which private sector employers set wages for direct care workers. And unfortunately, North Carolina has dramatically reduced the reimbursement rates for Medicaid and for long-term services since the start of the recession, from about $15.52 per hour in 2009 to $13.88 per hour in 2014. As you can see from the chart, this has pushed North Carolina's reimbursement rates to the bottom of most states in the country, significantly below the national average. That means that our seniors are getting, our caregivers are getting less money, which means that seniors are getting less care. And that's bad for all of us. So what do we do? From a policy perspective, there are a number of changes that we can probably make to Medicaid to ensure that that private sector employers, the folks who employ the caregivers and provide the services and are reimbursed by Medicaid, can make enough in order to pay their workers more and turn a profit. We can also find ways to make sure that workers get a bigger share of an increased reimbursement rate. More wages, better wages means better care in this case. So this comes down to what y'all can do. There are a number of policy solutions we can promote. We're figuring what those out. We really invite y'all to help us figure out what those can be. But in the meantime, what can we do here today? First, join our campaign, the Campaign for Quality Wages for Quality Care. We're going to be circulating a sign-up sheet for folks who are interested in learning more about the campaign and figuring out how to advocate with our legislators and our state government to make sure that that they hear our voice on this important issue. And then afterwards, my colleague Anna Pardo will have a series of little activities or opportunities for you to express your support for better wages for caregivers and better quality of care. And we'll do that immediately after the last speakers. And so the last thing I would say is I've given you all these numbers. We have two fantastic folks to come up and talk about their experience with as being a worker and being a senior, and how their stories are the human face on all these numbers that I had to give. And know that every single number that I gave represents lots of human faces who deserve quality of life and dignity of life at the end of their lives. So thank you. We'll move to the rest of it.
I took it personally when you talked about how North Carolina is aging. Hi, everybody. Hi. Excuse me. I just want to, as I begin my remarks, I want to acknowledge that we have a great labor leader with us, and that's Mary B. McMillan, State AFL-CIO. There's a connection between us, and I want to acknowledge, and our retiree organizer from the Alliance, Heather McLaughlin, who knows when to applaud and laugh at my jokes and applause lines. You may wonder why the Alliance for Retired Americans would be speaking at an event about home health care workers, and there is a connection. Every one of our members is either a senior community member or a retired worker, usually from a union job. We talked about the wages that home health care workers make, and the average, I think, now is $9 an hour. Now, it may have been caused by Medicare reimbursement, but I'm sure by a decrease in Medicare reimbursement, or Medicaid reimbursement, thank you, but when the reimbursement went down, it wasn't that the agencies that provide home health care workers took the hit. They may have taken the small hit, but the biggest hit was taken by the home health care workers. Home health care workers are the connection to the world for seniors that need their assistance. Very often, they may be the first person to notice that something's changed, that something needs to be paid attention to. They may be the only person that the senior sees in the course of a week that they can have a connection to the world with. So for folks who came out of good union jobs and are retired, they need to be cared for in the way that the fabric of that they had when they were working, which is why there is a movement afoot in the country to organize home health care workers. And in fact, in some states, in some jurisdictions, home health care workers are organized. And you can see the difference in the way they're treated and the wages that they earn. They have health benefits. Now, in North Carolina, most home health care workers do not get sick leave. So do we really want a person who is under the weather, maybe coming down with something, caring for a vulnerable senior? I don't think so. Home health care workers ought to be able to earn paid sick leave. They don't get, many times, they don't have any vacation days. So people get worn down. They have their own responsibilities at home. They have their own children, immediate families to take care of. And on $9 an hour with many times no health benefits, that stress can cause a reaction on the part of the senior. So, what's the message? Keep a basic platform for the senior between nutrition, medicine, and activity. And home health care workers, to make that connection, should receive decent pay. If that's for me, I'm not here. Should receive decent pay, decent health care benefits, so that they in turn can give quality care to the vulnerable, the most vulnerable in our society. And that's what I have for you.
Hi, my name is Kim Thomas, and I do live in Representative Hawley's district. I am a home health care worker in Raleigh, North Carolina, but I travel all over in literally North Carolina. Sometimes I've gone as far as Winston-Salem, Reidsville, Greensboro, Bahama, so it's a very broad spectrum. I've been in the home health care field for about 6 years, going on 7 years now, and it is a job that it's not just a job, it is a career that I chose because I enjoy giving back. I enjoy the service that I provide. And there's very few people that can handle this type of work on a day in, day out basis. So roughly I work 90 to 120 hours a week, and I only get paid $10 an hour. So at the end of the week, I'm still kind of stuck when I get my paycheck trying to figure out what to pay. Generally, I have to choose who I pay and then work out the rest later on. So working in the home health care field has given me great reward mentally, and it's satisfying work when you're giving back to seniors and to those with disabilities. I provide care generally around the clock. So I would start my day, Tuesday starts my week. I work Monday also, but I just beg for Sundays off, let's put it that way. So I work 6 days a week. I was working 7 days a week. So I start work a minimum of 16 hours when I do start work. So today I took time out of my schedule to come and talk to you guys. And I mostly work leaving one job to the next, leaving one job to the next. There is a shortage. So I work for 3 different agencies. And why do I work for 3 different agencies? A number of reasons. Number one, to make the income that I need to make, number one. Number two, because if I do have someone that passes away or leaves the company or agency that I'm with, then I have another agency that I can go to that fill those hours. So I kind of overlap. And what happens is, I'm one of a few that do this, but what happens is, when you don't have any work, because there are no benefits, because there's no dental, medical, vision, there's no retirement program, there's no incentives whatsoever, there's no overtime pay, there's none of this is in place for any of the agencies that I work for. Even the continuing education I have to pay for out of my own pocket. So I have to pay for my own CPR, I have to pay for my own TB test, and these are things that you have to have in order to work in the field. So you have to be, this is actually a profession. It is not just a job that you just go and say, I want to be a home health care worker. You have to get training for this. This is not something that you can just walk in and say, oh, I want to be your caregiver. Family caregivers, that's a little different, because they've been debriefed by the doctors and nurse practitioners and everybody else, which is what we also do. I take a lot of my orders from the doctors, nurse practitioners, and I have to follow through. I do physical therapy. I help with COPD patients, which means that's respiratory care. I do cancer patients, end-of-life care, which is extremely hard. Alzheimer's patients, which can be challenging because there's always a constant redirect. Anywhere from Parkinson's. So the variety of home health care that I provide is vast, it's huge. So I provide a lot of home health care, and I have become a commodity. The three agencies that I work for call me constantly. Number one, I'm dependable. Number two, if I'm that dependable and I go to your home and I'm with your loved ones, you don't have to worry when I'm there. They're going to get bathed, they're going to get fed, their activities are already in place, physical therapy, whatever they have to do is already there because I'm there. I'm very dependable and have been very dependable for over 6 years. So with that being said, I provide those type of care, that type of care, and have been providing that type of care. And I treat these loved ones as if they were my own mom, my own dad. And I had lost my mom for some of the similar reasons. And we did not allow home health care to come in and take care of her. She actually ended up going to hospice. But with that being said, I treat them just like they were my own mom and my own dad. And I would want somebody to want me in there because they know that I'm going to give them quality care. In spite of the amount of money I make and in spite of the amount of hours that I still give 120% when I'm with your loved ones. And that's just me, that's just how I operate. I have had the opportunity to attend 2 White House conferences on aging. So I actually sat in on the last one, and I was actually on the first panel of the first one. What an ominous experience that I had when I was there. It was beyond my understanding, and I had no idea what I was going to encounter when I went there, but it was awesome. I got to have a one-on-one conversation with Secretary Thomas DePrez for about 30 minutes. I sat in his office at the Department of Labor and actually told him about my concerns and about how hard I work. I have an unusual work ethic, but that doesn't mean that I have to have unusual pay. So those things were some of the things that I experienced, and having been able to experience him, I had an opportunity just this past Monday after attending the White House Conference on Aging. We were lobbying with some of the representatives, and I had the opportunity to go to David Price's office and lobby at David Price's office and at least get to talk with someone in his office to let them know that we are here for the Fight for 15. And that Fight for 15 is extremely important. Why is it important for us to make $15 an hour? Number one, you'll have someone like me who already is giving you quality care that gets paid a livable wage. I can pay my bills. I don't have to worry. I don't have to be distracted when my phone rings. It's a bill collector, and I'm like, oh my goodness, I just declined the call. You know what I mean? I can just go to work, and I have confidence that I'm going to be able to pay my bills, and you're still going to get 120% of my care, my time, and the quality that I provide. So what I do right now is I work 120 hours a week. This is my reality. I will go to work, say Tuesday morning, I start out at 4:30 in the morning. I will work probably through until Friday at 12:30 at night. So what happens is I take naps in my car, 20, 30 minutes between, I eat on the run. These are, what I'm saying, this is my reality. This is how I live. And because I work so many hours, I have to make the income up so that I can pay my bills, or at least pay some of my bills on time. I am the face of the home health care team. When the person comes home from the hospital or the senior is there in their homes, number one, that allows them, it's a tax break for a lot of people. It's a lot less expensive to have someone in their home, number one. Number two, it allows that person to maintain their comfort of level. Their comfort of level comfort, I guess that's what I'm trying to say. But whatever, it maintain, they have the dignity that they have. They've been in that home for 30, 40 years. Some of them have been in their home since they were children, and that's their family home. And they don't want to leave and go to a nursing home or a rehab facility. And they don't get the one-on-one care that you could get with having a home health care worker. So it's important to maintain the home health care field, and it is the fastest growing field. But I have to understand that there are people like me out here that is providing quality care but not getting quality pay. So it's important to understand that. I love doing what I do. I really love doing my work. But it's not enough as a home health care, because it is the fastest growing job, but it's also the lowest paying job. We are the forefront. When they come home from the doctor's offices or their hospitals or their rehab facilities, we have to follow every instruction that was given by the nurses, the doctors, and any other specialist that was on their team. So we are the forefront. We maintain their level of dignity. We provide the care. We give them showers on a regular basis. We give them 3 square meals a day. I'm there cooking for them. I take them shopping. I play bingo with them. I play bridge with them. I do anything that they want me to do, within reason. But anything that they want me to do, I do those things because it's important. Those are things that they're accustomed. These are viable people. Some of them are very, very, very accomplished people, very important people. But now they need help. And some of them, it's hard for them to accept help, especially if they have the Alzheimer's. It's hard for them to accept the help. So somebody like me comes in, and I kind of joke around with them and laugh with them and have fun with them. But I also know that I'm there for their safety. I keep them safe, which is the #1 thing. I can tell you on 2 fingers how many times a client in 6 years has fallen on me. Two times, which means that I'm doing my job. I'm doing my job. They don't have broken hips. They're not abused. They're nutrition. And I started with a new client this Saturday, and unbelievable. The client has Alzheimer's, and not once did I have to bother the son that was in the home. He said every other caregiver came in there, they bugged him, and they asked him, what do you want me to do now? What do I do now? I gave her a shower. I didn't call him. I fed her. I didn't call him. We played games, we played music, we did our exercises. I didn't call him. 4 hours later, he was like, I didn't even know you guys were still here. Because that's how much I love doing my job. But I also like to get paid for doing what I do. I also really like to get paid. So I'm here lobbying for you guys to help me and other caregivers that enjoy doing our job. Please stand with us on the Fight for 15 and help us get a livable wage so that we can pay our bills and then provide the quality care services that your families want and need.
And to Kim, I want to say a special thank you. Thank you for taking care of the people we love. And most of all, thank you for your courage and leadership, standing up and demanding fairness for home health care workers. I think that because of your efforts and the whole Fight for 15, that we will win better wages for caregivers. Because as Bill said, part of the reason workers in other states have higher wages is not just the Medicaid reimbursement rate. It is the fact that workers organize and they have a union. So I was wondering if you could talk a little bit more specifically about how folks can support the Fight for 15 in a union, whether you have events coming up or how people can be supported.
Well, I have joined forces with the Fight for 15. Back in December, January is when I joined. And merely, this is kind of like a side note, but what happened was, surfing Facebook, as we always do, my cousin, who's actually a very prominent journalist in the Memphis, Tennessee area, had an excerpt on her Facebook page said, join the Fight for 15. So I thought, wow, for home health care workers, I thought, wow, that's pretty interesting. So I clicked on like this page, and not maybe a couple of weeks later was I joined by some of the SEIU people, which is the Service Employees International Union. Anyway, when they came and sat down and they talked to me, they explained to me what really the Fight for 15 was and why was it so important to have that. Having a union and the Fight for 15 basically means we're fighting for a livable wage, $15 an hour. That's what Fight for 15 means. So if you go over on the websites of SEIU or Fight for 15, you look it up on Facebook, there are a lot it started by, I think, fast food workers wanting a livable wage and wanting more pay, and everybody kind of thought, well, that's kind of crazy, you know, why does fast food workers need that kind of money? But our services as home health care workers is actually an invisible job, but a very valuable job. So I joined the Fight for 15 because I wanted to know I wanted to fight for something that, one, I'm in the field for, and two, I believe in. I'm not always going to be able to do this work, so I want somebody that's paid enough money to take care of me when the time comes. So I joined the Fight for 15. Having a union means that we no longer have to accept what these agencies are offering us to pay. They have to join, we're a part of a union, so if you're part of a union, you have to follow the union rules or whatever, and I'm paying my dues to the union, so you have to kind of follow the guidelines of a union. And the union means that they fight for us, they're a voice for us, they set down some of the groundwork that enables us to be able to function. In this field, you have steel workers union, you have a railroad union, you have all these other different unions that are formed, and your postal workers union that have really made a difference in the economy for these people's lives. And that's what I want a union for, and that's what Fight for 15 and forming a union means for me, and I'm sure other home health care workers as well.
That's great, thank you. Other questions from the audience? I have some of my own, but I don't want to. Go ahead, Mary.
Yeah, Mary Bethel, so Mary Bethel follows Mary B. And what you're proposing, $15 an hour, would this be direct pass-through of $15 an hour? Because a lot of times when you get an increase in reimbursement for providers, say, sometimes that reimbursement does not get passed through to the workers in the form of increased wages. So have y'all thought about any type of legislation that would have direct pass-through to ensure that $15?
Well, I'm on the lobbying part of it, so I don't know all the ins and outs of having something to do a direct pass-through. I do know that in the state of New York, they have the labor people sitting down right now talking about making fast food workers' jobs across the whole state of New York $15 an hour. So which means that that's the minimum wage for fast food workers there in New York City. However, the difference between the cost of living there and here makes a big difference. However, but at the same token, Washington, the state of Washington won $15 an hour. They just now won their retirement benefits for home health care workers. So the direct pass-through is probably absolutely possible and is there, but it's getting all the other stuff through legislation now that we're trying to get through. So to answer your question, yes, in one case, and in the other case, I really don't know all of the ins and outs.
I think some of our other panelists have some responses.
Yeah, North Carolina is not a union state. Rest our souls.
To put it mildly.
Rest our souls. And the way I see this is I see each home care worker as an independent business person. And that's how they're being treated. They're asked to get their own insurance. They're asked to provide their own transportation. They're asked to do everything like you would an independent business person. And if you recognize that because it is kind of a new career path, it is a new career path on the scale of jobs in the market, because now we've got home health care workers and they need to be treated as the independent business people that they are. Either you're going to pay them enough money for their salary that they can then pay their own housing, they can feed their families and take care of it, or you're going to pay it another way. It's what pool of money are we going to pull it from? Are we going to pull it from the welfare rolls when we have to supplement somebody with food stamps? Are we going to pull it from the housing rolls when we have to provide Section 8 housing? It's still coming in to the individual, but in a different kind of form. And those forms lack dignity. To me, the form that lacks the most dignity is let's pay them a living wage, let them provide for their own insurance, let them provide for their own needs a way any other business person can. So one of the ways we can look at this is we can look at this through an economic development way and try to see if there's some kind of legislation or something we can do to strengthen them as independent business people, even though in many instances they're not considered that. You considered working for an agency, right? So you're an agency employee, but if you were an independent business person under contract with that agency, which is how they technically are treating you. So we need to look at how people are being treated on that kind of level and see if there's some kind of legislation or something we can do. It's coming out of our pocket. Do you want it on the front end or the back end? Do you want it in the form of welfare, or do you want it with dignity where they have the wages, they can pay their own bills and take care of their families? I prefer the second way.
Absolutely. Alan, we're going to go. We have one more. We'll have a question after Alan.
Yeah, I just wanted to quickly follow up. Medicaid, as I'm sure y'all know, is a deeply complicated program. The complexities are enormous, and I know we're still learning about it. We're hoping that y'all can teach us. The complexity means that we have to figure out the extent to which Medicaid can set the right reimbursement rate that makes it work for private employers to provide care and that provides adequate wages to caregivers. And so we, at this point, don't actually know what that number is going to look like. But we look forward to working with y'all, working with employers, particularly good employers trying to do the right thing. I want to recognize Ari Meadoff, who is an example of an employer who's trying to do the right thing in terms of wages and benefits for his employees. We want to make sure we have a Medicaid system that makes it easier for folks like Ari to take care of folks like Kim. And in a way that pays adequate wages and meets the needs of the seniors in a way that provides quality care. So we are in the process of figuring out, bottom line, we're trying to figure out exactly what that number needs to look like and what needs to happen with that Medicaid reimbursement rate. We're in process on that, and we look forward to hearing from y'all on what that needs to look like.
Sorry to drape that across your knee. A question there in the back?
Yeah. Doug Dickerson here. So, Alan, this might be for you. Do you know about what proportion of clients are paying directly as opposed to being paid for their home health care through insurance or through any other types of intermediary?
I don't know. That's a good question, and I'll figure that out. I know Kim said, what, 100%?
100% are direct pay to the agency.
Yeah, yes.
But there are a lot of folks that find their own caregivers
Right.
and
Yeah.
pay directly, and
Yeah.
particularly in areas where you don't have so many options.
Then you have people who have long-term care insurance
Mhm.
who are paying themselves.
Well, my question is sort of leading into is what do we think would be the negative effects on those individuals if home health care became, I don't want to say unaffordable, but instead it became, all right, if I'm going to pay $15 an hour for home health care and I am on a fixed budget, what am I going to have to give up? So I'm curious about that elasticity.
Yeah, let me just say, those are the kinds of questions that we are trying to wrestle with. There is a number that Medicaid needs to pay that sets a framework for private employers. There's also the point at which the numbers just don't work. And so that's it's a technical question, and we're trying to figure that out. We've just started this initiative. And as you know, Medicaid is undergoing significant study and significant discussions around reform, which means a lot of the normal features of the program we would look at are in flux. And so I think the question about what that number needs to be is something that we all need to pursue together.
One of the things that I've realized is that most of the agencies are direct paid by the consumer. So the senior that is paying is direct pay. They pay the agencies. The basis is probably around $22 an hour to have someone like me come in. So is it something like maybe having the agency redirect the money? If an agency has over 200 clients, they more than have enough money to pay $15 an hour. So I don't know, in some cases, I don't know the real reason why the agencies are only paying the home health care worker the $10, $7, or $8 an hour. I don't know. It's anywhere from $8 to $10 an hour is what the home health care worker gets paid. And the agency is taking home $22 an hour based on that. So maybe it's some redirection in that respect about how the money can be reallocated in that respect.
To catch.
Let me speak from the point of view of the payer. And my wife, Dee, had a mother who lived in a retirement home in Raleigh. She eventually died, she was at age 94. 96. In the last 2 or 3 years of her life, she loved her retirement home. She loved where she was, and she didn't want to leave it. And so we arranged to have her have her attended to by home health agencies. And they were good people, and some were better than others, but by and large, they were good people. It was costing us, it was costing her. She had only Social Security, and the investments she and her husband had made during her life, no pension. It was costing her $15,000 a month. And when she died, I paid her, I was paying her bills. When she died, I figured that we had about 4 months to go before she would have to go on Medicaid.
Appreciate you sharing your perspective. Points out the difficulties that confront individuals in making these decisions because of the way our society has decided to divvy up their resources. There's a question here, ma'am.
Yes, my question is there any legislation pending that's related to these issues, or are we at the very beginning of this process and trying to form what the legislation should look like and what should be components of it?
I'm going to plead ignorant because I'm not on the aging committee, so I don't know of any particular legislation right now. I'm telling you though that legislation that is coming, you know the particular ones that are coming up. Which ones are they?
There were actually 3 or 4 bills introduced relative to workforce issues this time. ARP was engaged with the Caregiver Coalition that had a couple, but there was a couple of other bills. I think maybe the Justice Center and some other folks had part in. They did not go anywhere as they were introduced. My understanding is, because I've retired here recently, but my understanding is that they put them into the form of a caregiver study bill. Yes. They did pass the House with no opposition, if I remember correctly. The problem is that it's sitting in the Senate, and there doesn't seem to be any movement on any of that. So
let's not movement on anything. I hate to say that, and I do know that caregiver. Thank you for reminding me of the caregiver study bill. There are a number of things that people are trying to do, but right now we're in that budget process. And if you think that this is this side looking at that side and nobody's even talking to each other, that's exactly the way it is down at the General Assembly right now. So we're trying to work to break the ice and try to get some dialogue going, and particularly in the human capital areas. We pay people more to look at a machine or it all day long than we do to touch a person. And we need to look at where our value system is. Is it going to be on the human capital, or is it going to be on these extraneous things that we now have made more important than we've made people? I think it's a whole movement that needs to happen, not just in caregivers, but in our society as a whole, where people now begin to realize what is important. And we need to put the importance back and the emphasis back on people and make those the positions that pay the most. Your teachers who touch your child, your child care workers, your caregivers, your other people that deal with people, social workers, that people deal with people on a day-to-day basis. So we need to look at some of that. And that caregiving, as far as the study bill, it does need to be studied. There is a way that it can be done without the House and the Senate working on it. And I will try to see if we can, if it doesn't go through both, I will see what I can do about seeing if we can get the House then to do an independent study bill. Because the more they look at it, then that brings people in like you to come and talk about it. Then the more educated we become of what the issues are.
Let me close by saying this, that I think we can all agree that we need to make sure our caregivers get paid quality wages so that we can ensure higher quality care. We are in the process of figuring out what that means in terms of specific legislation, what that would specifically mean for Medicaid. And we are just starting this process with y'all to hear your perspectives, but also to help build public awareness that there is a problem around caregiver wages, where you should not have to work for 120 hours a week and make $10 an hour and still have struggled to make ends meet. So So that's what we're trying to do here and invite you all into the conversation. I know we're going to have a series of actions immediately, opportunities to engage around this issue immediately after. And I just wanted to flag that. I know we're getting close to time, but if you want to stick around for 5-10 minutes afterwards and talk to my colleague in the back, Anna, about the immediate opportunities you can do. But again, I just wanted to close. I know we've had a lot of numbers discussed, a lot of different perspectives, and I just want to be clear that we really, I think all in this room can agree about the importance of quality wages to ensure quality care.
One more question here. I see Claremont has a question for us.
I just wanted to make a comment in response to your question, which is there is a misclassification bill that's still alive, that still could pass, and to the extent that home health care workers are misclassified as independent contractors when they should be getting the benefits of employees, that bill could help them. And there also were several pieces of legislation to raise the minimum wage. I don't know if any of them are they all dead? Okay. Well, we could continue to work on those in the future. Those would help all workers.
Well, I would say there will be an action alert going around from the Justice Center this week that's asking our legislators to raise the minimum wage. And we're grateful for Representative Holly's support of that.
Anna Pardo is this lovely woman in the back in black and salmon, who would love to talk to you individually or in small groups after the event. Is that right, Anna? So do look her up after the event. Come back. She can talk to you about how to become more engaged in this, what is obviously going to be a long-term fight to bring some justice to this very important area of our economy. Is there one last burning question that anybody has? We have one more over here.
What states are doing better than we are? We should model ourselves out.
California.
The question is, which states are doing a better job than us? And Bill?
From the chart, well, it's not up there right now, but there's a chart that shows that North Carolina is the 7th worst in the country in terms of the amount we reimburse for Medicaid, reimburse for caregiving. So it would seem that almost every state is better than North Carolina in terms of the pure number for the reimbursement rate. There are a number of best practices in other states. Montana, Connecticut are two examples that have sought to increase the reimbursement rate, but also make sure that a bigger portion of that reimbursement rate goes to workers, but in a way that's sustainable so that it works for the employers as well.
Be on the lookout for more information from us about that. Thank you for being with us. Again, come see Anna after the event, and look for us at our next crucial conversation next month. Be on the lookout. It'll be in your emails. Thank you.